healthy dose of information brought to you by Hannibal Regional Hospital. Joining us here in Studio H this morning, the Speech Therapy Department Director of Speech and Pediatric Therapies at Shelley Bergman. Good morning, Shelley.
Good morning.
How are you?
I'm good. How are you?
Great. It's good to have you here in Studio H this morning. Everything going all right with you this morning?
Everything is going very well. I had my coffee and I'm ready to go.
Off to a good start.
Yes.
All right. It's time to talk about speech therapy, especially how important that is with children. And you're doing some really great things to help kids out.
We are. Speech therapy is extremely important for children. The earlier we get children in, the better off they are in regards to developing those communication skills that, as everyone knows, follows you throughout a lifetime. So we are doing some very exciting things in our department, starting with a fundraiser that we have coming up on April 11th called Cheers for the Kids 2014. Like I said, it's local. It's organized by three local organizations, the Missouri Right Care Group, the Hannibal Regional Hospital, and Hannibal Regional Hospital Foundation are working together to put this on.
That's a great thing. A lot of kids in need of speech therapy?
There are. There are several children out there that need speech therapy ranging, from birth all the way up through adulthood, actually. So.
Are there kids that aren't getting the therapy that they need? Is that what a lot of this is geared toward?
Unfortunately, that is true. There are children out there that don't get the services that they need, or the services that they are getting are not always adequate. So we have come up with a way to support those children. An instance would be if a child needed speech therapy services, the family sought those out, and the insurance company may say, well, unfortunately, we don't cover that. This fundraising activity allows us to provide families with scholarships that they can apply for if the child meets specific clinical guidelines or specific financial guidelines. Then they can apply for a scholarship and the child can get the speech therapy they need for a nominal fee of $7 a visit.
What do families need? What do parents need to be able to get a child the therapy they need and have it covered?
All you need as far as being able to participate or even to seek out and see if your child needs speech therapy services is a doctor's order. From there, then we can evaluate your child and tell you what your child may or may not need. We also provide free screenings. So if you have a child, you're not really sure if a doctor's order is something that you want to pursue, but you want to get our professional opinion on where or how you should proceed, you can certainly give us a call. We can get your child in and perform a screening.
And that's why you are providing these speech and language screenings to local daycares and that as well.
Absolutely. And this year alone, we have screened over 260 children.
Good.
So we are out there, we are hitting the streets, and we are trying to provide the services as soon as we can.
Do you know what percentage of children actually need speech therapy? I mean, is it a high percent?
I don't have that percentage off the top of my head, but it is high. And the problem with having that percentage is that there are so many disorders and so many delays that fall into that category. Mm-hmm. I do know that it is a very high percentage, and I do know that our school districts are so overwhelmed by kids coming through their door that sometimes those children don't meet the specific guidelines that the schools have placed on them by the state.
Who picks up on the problem? Is it the parent or the teacher, maybe?
It can be either or. Most of the time it's the parent initially, but once a child goes into a school district, a lot of times the teacher can be the referral source and say, I think this child needs to be screened or tested for speech and language deficits.
What age can you tell that there may be a problem?
You can start telling that there is a problem as early as 1.5, 2 years old. When a child is 2, they should be producing, at least 2 words together. And that child should be intelligible about 75% of the time to an unfamiliar listener, not just mom and dad.
Okay, so if you think that your child has a problem, what are the things that you should be looking for? What are the identifying factors?
One of the things that we look for at an early age is we look for, does the child have an attention span at age 2? A child should be sitting and attending to a task for about 1.5 to 2 minutes without being distracted by other things going on in the environment. A child should be able to follow some very basic commands. They should be able to identify some very basic familiar items in their environment, such as balls or shoes or their favorite sippy cup. They should be able to give you eye contact. When you call their name, they should be able to turn and look at you. So those are some basic things that we look for and we ask parents.
So maybe a problem too with hearing.
Absolutely.
Okay.
Absolutely.
And then, so at that age, though, it may be that they're not hearing you. Later, it's probably that they're choosing not to hear you.
That is correct.
That's the way
That
it
is
works?
correct. I run into that a lot with my kids.
That's why I can talk about
And as you
that.
get louder,
Exactly.
it doesn't matter.
Absolutely. So tell us about the Cheers for Kids fundraiser. Give us the details on that.
Excuse me. Cheers for the Kids is going to be occurring on April 11th, which is a Friday of this year. It starts at 5. It runs to 9. Cost of tickets are $20 a person or $30 a couple, with a couple being any 2 people. With the purchase of a ticket, you get 4 wine tastings. There will be appetizers present. We're going to have jazz music provided this year by the Twain City Jazz Band. Wine will be available for purchase at any time through the evening, with a portion of those proceeds being donated to the scholarship fund. A commemorative wine glass for the first 100 people through the door will be given, and you can purchase your tickets in advance or you can buy them at the door.
That's great. Where's it being held at again?
Cave Hollow Winery in
Okay.
Hannibal, Missouri. It's located directly across from the Mark Twain Cave.
Great. If somebody wants to attend, what do they do?
You can just show up at 5 o'clock at the winery and walk through the door. It's very casual. Last year it was very relaxed. We had a great time. Or if you're interested in purchasing your tickets in advance, you can call 573-406-5777, or you can call 573-629-3577. And I also want to point out that any money raised for this evening stays local. It does not get spread out through the state of Missouri. It stays local for the children in our community.
Okay, great. And thanks for all you're doing for the kids. If somebody wants to have their child assessed, have them evaluated for a problem, a screening, what do they do?
Call us at the 573-406-5777 number, and we can certainly, you can speak to a therapist directly, or you can make an appointment with our secretary. She'll set you up for a day and time to come in.
All right, very good. It's Shelley Bergman, who's the Director of Speech and Pediatric Therapies, Hannibal Regional Hospital, right?
Yes.
All right. We appreciate your time, Shelley, and thanks for the information. We encourage everybody to get involved. The Cheers for the Kids fundraiser, the 2014 fundraiser, and the date again on that is
April 11th.
April 11th, coming up right away.
Yes, right away.
Okay. Thanks, Shelley. We appreciate it. Thanks for coming in this
Well,
morning.
thanks for having me.
That's your healthy dose of information from Hannibal Regional Hospital. You can check them out online at hrhonline.org.